Hi everybody, I'm Pamela Atwood, a gerontologist, a certified dementia practitioner, and a certified laughter leader. I've got more than 25 years of experience helping families and individuals with issues regarding aging. And we've created this video series to help provide some information and resources for you. General topics, and we'd love for you to have the ability to ask us questions. So please, in the comments section, definitely subscribe to the channel, and then also let us know what topics you'd like us to cover. So I promised our confident caregivers in shows 1 and 2 that I would continue to answer some of the most commonly asked questions. So the show today is about those questions regarding to memory. And I get asked these questions on an almost daily basis. And I think I'm going to relieve a lot of your concerns about memory. So for those of you who also follow me on Instagram, it's pamela.atwood. I just posted something this morning about a Rubik's Cube and how your brain is designed to forget. So you might want to check that out too. The first question that I get asked almost every day is about memory and whether or not there's a difference between Alzheimer's and dementia. And a lot of times when I'm teaching or lecturing or doing presentations, I will use the terms interchangeably, dementia and Alzheimer's, but let me describe the difference. Alzheimer's is a neurological disease. What's happening in the brain is a damaged process that's affecting the cells in the brain. Now, there are lots of conditions that are neurological: Parkinson's disease, MS, some forms of epilepsy. So all of these things are happening in the brain cells or in the brain regions. Alzheimer's is a disease that happens in the brain. The first and most common symptom that people know Alzheimer's by is what we call dementia. Dementia is about the thinking. So dementia, by definition, is a loss of intellectual functions, things like reasoning, judgment, and memory. Now, for people with Alzheimer's disease, their short-term memory goes first. So if we look at it the positive way, their long-term memory stays and remains latent to the disease. But dementia is just one of the symptoms of Alzheimer's disease. As dementia is going through the brain, it starts to affect different parts of the brain. And when it gets to the back of the brain, that's where people start to really lose some of their other functions, like their ability to walk. Although, let me just give a quick little aside, what we're learning about people with younger onset Alzheimer's, it can affect people younger, rarely in their 30s and 40s, but we are seeing it more and more. But it's not uncommon anymore for people in their 50s and young 60s to be getting Alzheimer's disease. In fact, I have a cousin who was in her mid-50s when she was diagnosed with younger onset Alzheimer's disease. So as I've said before, I'm also a caregiver. I also have Alzheimer's and other kinds of dementia that run in my family. So I'm passionate about what we can do to minimize the risk. We'll talk about that in a minute. Where was I? Yeah. What was I saying about memory? Right, memory. Okay, so Alzheimer's disease starts to affect your physical functions as well. So your ability to get dressed, feed yourself, walk, eventually all of those things are affected by Alzheimer's disease, not just memory. So it's memory and another area, like so for by definition, the doctors, the clinicians will diagnose dementia when it's memory plus one other thing. So memory and language, memory and spatial orientation, memory and processing speed. So memory plus something equals dementia. Alzheimer's is the disease that causes dementia. For instance, let me give you a different kind of analogy. Pain. We all kind of understand that there is pain, but there are different kinds of pain. There's migraine pain, there's orthopedic pain or arthritis pain, there's hangnail pain or tooth pain, or if you have a skin irritation, that kind of pain. So there are different kinds of pain caused by different things. So in this analogy, dementia would be equivalent to the concept of pain. Alzheimer's would be the cause of dementia versus arthritis maybe is the cause of the pain. So that's kind of like the difference between Alzheimer's and dementia. And if that's not clear, I really, really, really want you to let me know. So type away in those comments and tell me how I've confused you, or if you think Alzheimer's causes pain. Oh my goodness, too many analogies. But for some people, we learn better with analogies and kind of being able to apply it. So I wanted to throw that out there. Another analogy that I use a lot when I'm training is the concept of furniture. So furniture is a general concept. Dementia is a general concept. Chair is a specific kind of furniture. Alzheimer's is a specific kind of dementia. Now, in most rooms, there are more chairs than any other kind of furniture. There's more Alzheimer's than any other kind of dementia. In our room, we can have more than one kind of furniture. You can have a chair and a bed and a table. Now, they may have similar features. For instance, they all have legs. Technically, you can sit on them, but each of them has a different purpose or a different way of being. So with Alzheimer's and other kinds of dementia, there's Alzheimer's, vascular dementia, Lewy body dementia, frontal temporal lobe dementia, a number of different conditions and diseases that can cause memory problems. There are similar features, but they are essentially different. And like I said, in your room, you can have more than one kind of dementia or more than one kind of furniture at the same time. You can have more than one kind of dementia at the same time in your brain as well. That's what we would call a mixed dementia. So I hope that's cleared up that question. Let me see. What are my notes telling me? My next question that I get almost every day, if not every day, is some forgetfulness normal? Let me tell you that yes, my memory isn't great. However, I do very much clarify that I remember late. That's different than being totally forgetful. So when we have stress, problems with sleep, problems with other health conditions, too many things distracting us when we're registering new information into our brain, those kinds of conditions can muddle our thinking and make it seem like we have a problem with forgetfulness. But in actuality, what we may have is either a hard time registering new information or recalling that information once it's in there. So we need to clarify exactly whether or not this is truly forgetfulness. But yes, some mild forgetfulness is a totally normal part of aging. However, one of the things that's very important to remember is that there are lots of conditions, some of which may be treatable or reversible, to memory problems. So what I want our folks to know, and especially caregivers, because a lot of times caregivers think, oh my gosh, that's it. I've been taking care of my loved one for too long and now I'm getting Alzheimer's disease. And that's not probably true. It's probably related to stress and sleep and whatnot. But forgetfulness is normal. However, when it starts to impact your daily life, that's when you do want to get it checked. A lot of times we still hear from health professionals, well, you know, you're a little bit older, what do you expect? I expect you to get a second opinion, because Alzheimer's is not a normal part of aging. Forgetfulness is when it's mild, but confusion and disorientation is not a normal part of aging. So it's really important that we're advocating for all of us, for our own health and well-being, to get that diagnosed. Now, what are the other things that can cause forgetfulness? Thyroid disorders, B12 deficiencies, elevated calcium and albumin in your blood, all kinds of different conditions that can cause the similar thinking problems, which could be reversed. Depression, very common as we age and as we're taking care and as we have different losses or changes in our life, retirement, moving to a different area, kids leaving your proverbial nest. Although with a 10-year-old and a 13-year-old, that might not be a bad thing right now. Totally aside, sorry about that. So those kinds of changes can cause a depression. Now, sometimes a mood is just a persistent mood, but when it persists for more than 2 weeks, and it again starting to impact your daily life, that's when you want to get it tested. Depression can cause a pseudo-dementia. Let me say that again. Depression can cause a condition that looks just like Alzheimer's disease. Now, if we treat that depression, your memory should improve. Even if you have Alzheimer's disease, 40%, the experts tell us, 40% of people with Alzheimer's are also clinically depressed. If we don't treat that depression, it seems that their memory is worse. That's also important for people who are having the so-called behavioral problems, because a lot of times the behavioral issues, whether it's anxiety, restlessness, irritability, those are symptoms of depression. And again, that person may have depression. Before we consider an antipsychotic, which increases the risk of death and stroke, we need to be trying an antidepressant. Okay, so yes, some forgetfulness is normal, but your brain is designed to forget. That's very important to remember. Otherwise, your brain would have to be like the size of our whole country to hold all that sensory information in. So the last question that I get a lot is whether or not there's anything we can do to minimize our risk. Now I want to clarify, next time you hear a report on your local news that blueberries may cure Alzheimer's or may prevent Alzheimer's, I cringe inside because I know everybody who has Alzheimer's is thinking, oh, if only I had eaten more blueberries. We never ever want to blame the person who gets Alzheimer's disease or dementia. But yes, there are some things we can do to minimize our risk. A few years ago, a colleague and I developed a dementia risk screen. It's available on the website www.agingcareacademy.org. There's no charge. You're not going to enter information into the computer. Totally anonymous. agingcareacademy.org. Look for our dementia risk screen. We did not want people to say, okay, this is what you do or don't do. What we wanted to do was start a conversation with your health professional. So, for instance, my doctor said, Pam, you know, your cholesterol is getting a little borderline. My first reaction is, my parents hate their statins. I don't want to go on statins. No, the next question needs to be, what can I do to minimize my risk? Because cholesterol is an increased risk factor. I want to know what to minimize my risk because I already said I got 3 kinds that run in my family. So what are the things that I can do? Okay, doctor, tell me what I can do to minimize that risk. So my doctor then has that conversation with me. So I want folks to go find out what are your individual risks for dementia and what can you do to minimize that risk. Bottom line is what's good for your heart is good for your head. Wear seat belts. Use a helmet if you're biking or even roller skating or doing a skateboard or something, inline skating. And be careful during skiing as well, although the landing's a little bit easier. Also, control your numbers, your blood pressure, your blood sugar, your cholesterol, your weight, all of those kinds of things so that you can minimize your risk. Hopefully that information is helpful to you. That pretty much wraps up the show for today. I hope that this has been helpful information. Please leave me comments about other show content that you want to see in the future. I'd be happy to share and answer some questions directly that affect you in a general way, of course, not giving specific advice. But I hope that this has been a helpful discussion, and I look forward to seeing you in our next show. Oh, let me wrap up with a quote. I did find a funny quote. All right, so I have 2 of them today. From Charles Schulz, one of my favorite authors of all time. Just remember, once you're over the hill, you begin to pick up speed. And from Bruce Lansky, I much prefer being over the hill to being under it. So that is my quote for the day, or my quotes for the day. And I hope you will remember to take your aging lightly, and that we'll help each other to grow in the future. Thanks for watching.